the incidence for the acute back pain is most greater than the other cases. So it takes about 50 to 60% of the patient. And the chronic back pain takes up to about 20 to 30%. And spinal disorders, including stenosis or spondylolysis or spondylolisthesis, comes about 10 to 15%. And rare, infrequent serious conditions happen around 4%, around about the compression fracture, and 1 to 3% for the acute disc herniation. And I would like to clarify the specific conditions, including piriformis syndrome and sacroiliac joint or thoracolumbar junction syndrome. Or sometimes I treat the patient who has knee pain or ankle pain with back pain, which seems to be the cause of the knee and ankle pain. So that is the basic incidence and proportion of every disorder that I consider in my private practice. So based on this incidence, and let's dive into the compression fracture with this case. This case is reported by my colleague who has his clinic in Seoul, Korea. And this is the real case that who had compression fracture, however, missed by the first evaluation by X-ray, so it is really meaningful to see. This patient is 77 years old male and had severe back pain 6 days ago, just sitting down on his butt on the ground. And the initial X-ray examination showed no abnormality. However, the patient felt excruciating pain. To describe it, it took 2 minutes to lie down on the bed for him. So it means that he had extreme pain, so he barely moved his body actively, so it took 2 minutes to lie down on the bed. However, the sensory test was intact, and compression over the lumbosacral area had no pain. However, after palpating the thoracolumbar junction, he felt excruciating pain and barely able to walk after palpation. It meant that he had something on the thoracolumbar junction just after sitting down on his butt on the ground. So my colleague who treated this patient rang the bell and let the patient retake the X-ray and then confirmed as compression fracture on T11. I want to explain why this case happened. When usually we see back pain patient and take X-rays, we usually take L-spine series, which has L1, 2, 3, 4, 5, and sacrum like this. So as the lateral view, we can see every single lumbar vertebra like this. Or in some cases, we can see one more level like T12. And let's see the case of compression fracture. Let's assume that this is the body of L1. And this is T12. And this is T11. I magnified this area and draw the vertebral body of each segment. And basically, the vertebral body have rectangular shape, and T12 as well, even though the size is a bit smaller than the lower lumbar vertebra. And in this case, the patient had compression fracture on T11. It means that the height of the posterior vertebral body is all the same. However, the anterior height of the body has been reduced due to compression. And that's what happens usually. So if we cannot see the whole length of the vertebral body, the diagnosis can be incorrect. So basic L-spine series that detects the sacrum and the whole of the lumbar vertebrae, it is not enough to investigate the thoracolumbar junction. And that is the reason why we have to focus on the thoracolumbar junction for the patient who is susceptible to compression fracture. Additionally, I want to clarify the cases that is more vulnerable to the compression fracture. First one, just like this, if the patient had osteoporosis, it means that their bone has less density and they are more susceptible to the fracture. And the second one is the one who used steroids for a long time to treat any kind of disease. As the steroid is a medication, it has a lot of fundamental effect. However, on the other side, the adverse effect of the long-term steroid use is the bone density loss. So it can make compression fracture. And the third category is about elderly people who have lower bone density and more vulnerable to fall down due to the loss of balance. And the fourth category is about the menopause, especially who is experiencing the hormone therapy. In fact, the hormonal change have effect on the bone density as well. So we should pay special attention to the patient of this fourth category. And I want to show additional tests that I can identify the compression fracture easily. This is called percussion on the spinous process, and I want to show you how I do it. I overlap my index and middle finger on the top of the spinous process and tap on top of my finger to concentrate the pressure on specific spinous process. In this way, I can impose vibration and pressure to the specific area.